this video we'll be demonstrating how to measure a cat's blood pressure using a Doppler, a blood pressure monitor. So firstly we choose an appropriate venue, so it has to be a nice quiet area, somewhere that's away from barking dogs and lots of human traffic and telephones. And I ideally will perform this procedure with the owners present in the consult room. We let the cats relax a little bit so they settle down for about 5 to 10 minutes before we start the procedure. And always using just really gentle restraint at all times with the patient. So first of all, we need to select the appropriate cuff size, and so typically that would be about 30 to 40% of the limb circumference between the elbow and the carpus. So for most cats this tends to be a size 2 cuff, so that, as you can see here. We then secure the cuff in place. So just wrapping it gently around the limb, and with most of the cuffs that are available, the Velcro is not fantastic, and so we need to just place a small amount of tape around the cuff. It's important not to put the tape sort of 360 degrees right around the cuff, because that will impact on our blood pressure measurement. Next we use some gel, and the more gel the better, I find, just to improve the contact with the crystal on the back of the foot. So this is a long-haired cat, so we just gently move the hair out of the way. You can clip, but I find most cats actually get a bit worked up with the clippers and they tolerate just gently parting the hairs a lot better. We then put a decent dollop of gel onto the crystal here, and then gently put that onto the back of the cat's foot. So back here onto the metacarpal region, and then we just give him a few minutes to let him acclimatise to that. We switch the Doppler machine on. It's really important to have the volume turned down at this point so that you don't give anybody a big fright. And then we're just very gently listening carefully for the pulse signal, and we just move the probe around until we can hear a nice clear signal. If you can't hear a decent signal, then maybe just remove the crystal and just put a little bit more gel in place, making sure you turn the machine off when you do this. So once we're happy that we've found our signal, we inflate the cuff, just gently using the sphygmometer, and generally inflate the cuff about 10 to 20 millimeters of mercury beyond the point at which the pulse can no longer be heard. We slowly deflate the cuff and listen really carefully for the return of the pulse signal. So you can see just going about 10 to 20 millimeters of mercury over where we can hear it, and then just gently deflating that cuff until we can hear the first sound of the pulse returning. So the systolic blood pressure reading, that's the pressure at which the pulse can very first be clearly heard. So we basically continue to deflate the pressure all the way down once the reading has been corrected. And what we do is we discard the first reading, and then we take another 5 or so measurements and take the average of those 5 measurements as our blood pressure. Once we calculate the average of those, between 120 to 150 millimeters of mercury would be the ideal systolic blood pressure for a cat. So as you can see, most cats tolerate this procedure really well, and as with any technique, the more you do, the better you'll get at performing this technique.